Hello, and welcome to our question of the week. This week's question relates to narrative notes. During one of your recent education sessions, one of the items you discussed was the narrative note with the assessment and the outline that should be used for this note. You mentioned a resource where it specifically defines what should be there. Please clarify. This week's question is answered by Jennifer Osburn, a clinical consultant here at HPS. The answer is as follows. The guidelines for documentation for medical necessity is stated in Publication 100-2, Chapter 7, Medicare Benefit Policy Manual, Home Health. In Section 40.1, CMS defines skilled medically necessary nursing services coverage and documentation. Additionally, in Section 40.2, CMS defines the same criteria as required for coverage in skilled therapy services notes. In part, these sections read, as is outlined in home health regulations, as part of the Home Health Agency Conditions of Participation, the clinical record of the patient must contain progress and clinical notes. Additionally, in Publication 100-4, Medicare Claims Processing Manual, Chapter 10, Home Health Agency Billing, instructions specify that for each claim, home health agencies are required to report all services provided to the beneficiary during each 30-day period, which includes reporting each visit in line item detail. As such, it is expected that the home health records for every visit will reflect the need for the skilled medical care provided. These clinical notes are also expected to provide important communication among all members of the home care team regarding the development, course and outcomes of the skilled observations, assessments, treatment, and training performed. Taken as a whole then, the clinical notes are expected to tell the story of the patient's achievement toward his/her goals as outlined in the plan of care. In this way, the notes will serve to demonstrate why a skilled service is needed. Therefore, the home health clinical notes must document as appropriate the history and physical exam pertinent to the day's visit, including the response or changes in behavior to previously administered skilled services, and the skilled services applied on the current visit, and the patient caregiver's response to the skilled services provided, and the plan for the next visit based on the rationale of prior results. A detailed rationale that explains the need for the skilled service in light of the patient's overall medical condition and experiences, the complexity of the service to be performed, and any other pertinent characteristics of the beneficiary or home. Clinical notes should be written so that they adequately describe the reaction of a patient to his or her skilled care. Clinical notes should also provide a clear picture of the treatment, as well as next steps to be taken. Vague or subjective descriptions of the patient's care should not be used. For example, terminology such as the following would not adequately describe the need for skilled care. Patient tolerated treatment well, caregiver instructed in medication management, continue with POC. Objective measurements of physical outcomes of treatment should be provided and/or a clear description of the changed behaviors due to education programs should be recorded in order that all concerned can follow the results of the applied services. Do you have a question for our clinical consultants? Join our HPS Alliance. For more information, visit healthcareprovidersolutions.com/HPS Alliance. Remember to like, share, and subscribe to our videos so that you don't miss future questions of the week, Monday Minutes with Melinda, and more.